G'day there, Hivers. It's Jono here. And I am now just sitting here at the end of the first quarter of the year. It is about time, I think, that we started thinking just a little bit about how well have we been planning, how well has our plan been going. And I might just share my screen here and show you the reason that I was inspired to actually make this video this morning is that last week I noticed that here in the Practice Owners Business Group, Katie posted this, which is, if you fail to plan, you plan to fail. I know that's a cliche, but one of the things that I know is that if you're creating your practice through intention, it's much more likely that you're going to end up with something that you really want, rather than creating a business that just kind of gets there via evolution. You know, as you go day to day and you're jumping at opportunities, then we say, oh yeah, let's do that particular thing. And if you're doing that without having defined your vision beforehand, then I think it's actually a real danger for you that you'll just end up with this thing that ends up almost being like a monster. So what I thought I'd do is just give you a couple of tips. And for those of you who are already in the Optimus group, you already know this. For those of you who are in Mastermind, actually it was this time last week that we did our quarterly plan present backs, and that's just one of the things that we do. And for those of you who don't actually have somebody in your team to actually present back with, I really advise that you get into this habit. So let me just show you, this is the guts of what we do in our planning here at the Hive. So here's what I work at. It's this basis of put your practice under the microscope now. And so we're going big picture first, and I think it's always good to reflect back on the big picture. What have we got in our practice now? Let's have a really good, honest look at what the current reality is. And for you, that might include putting the team. This is the model. The real estate, have we got that right? Have we got the right people? Have we got the right size team? We've got the right mix of practitioners and support team members. Do we also, are we presenting ourselves to the kinds of patients that we really want to be serving and niching in a particular way? We're in the right location. How much money are we actually bringing in? Is it providing the owner financial security? Is it actually being able to compensate the practitioners and the support team properly? And then also to think, okay, what's my current commitment? For some people, once you get to it's often this stage that we see with a lot of practices where you open your doors and you're flat out trying to get new patients. And then down the track, and this is where I know a lot of people who actually come to work in Mastermind with us, they've got to the stage where there's so much business coming in that, but you're not leveraging it out to your team members, and it's just craziness. Anyway, let's have a quick look at your current reality. And what I would suggest to you, and for those of you in Optimus, you've got all access to all of these templates, by the way, but is to just go through, and I think I have this template open in, actually here it is. It's just here. Create a bit of a list of what your current practice looks like at the moment. And some of the things, particularly, again, look, I'll just show you where it is. This is for those of you who have access to the Optimus program. So it's anyone in the Optimus group or anyone in Mastermind. If you go into Optimus, and it's the whole map section here. So again, this is really a lot of detail on planning and getting your vision, your values, standards, why, and how to do quarterly planning. So this is where you find it. So these kinds of things you need to know, the locations, the rooms, the scope of practice. You're going to focus somewhere, and then the actual people and who actually makes up your team, the scale of work that you want to be doing in terms of the number of appointments. And then this is the personal side of it. I think you really need to be working out how much commitment in terms of the hours, the treatments, also how much you want to be treating versus how much you want to be, particularly if you've got a team, how much you want to be mentoring other team members. And one of the things that I notice, and I'll just point this out as another tip here, with this annual turnover, I see a lot of practitioners who go, oh yeah, we want $1 million practice or a $2 million practice. And it's almost like it's this arbitrary number. And what I would suggest is that if you're kind of just looking at this arbitrary number that sits out there somewhere as this, oh yeah, that would be great, go through the exercise of how much do I actually need personally? A lot of people, depending on exactly where you are in your life, maybe you've got a mortgage and you're living in a metropolitan area. Maybe you don't have that. You're living in more of a regional area. And so consequently, you may not even need a lot of money to actually service your lifestyles. A single person living in a regional area might only need $70,000 or $80,000 a year. Somebody with a family who's supporting, kids going to high school and all those extra activities, maybe you need, $250,000 a year. I don't know, but work that out, because again, the practice is there to support you, not you to actually be a slave to the practice. So work out all of that stuff first. And what that is just having a really good look at the current reality. Now, here's the thing. We don't then, okay, let's make a plan. And I'm going to when we're talking about planning, I define the words really clearly as the plan is the step-by-step part of it. The vision is this broad outline, which is, all of this stuff, your team, your patients, your systems, that would exist if this was your ideal practice. So this is the process first. Under the microscope, current reality. Out there, ideal practice. And then use the template that you've got to actually make some notes here on what is this ideal practice. And notice that I've deliberately gone from the current reality, and then I'm skipping this 12-month section first, because I'm not wanting to work out the how. I think that's the thing that actually gets us tripped up a little bit. We think about how are we going to get there. Don't do that. Go first into creating a really clear picture of what your ideal practice is. Now, some of these things may be more or less important to you. There may be others that you want to include in that. But again, that's up to you, because your ideal practice is exactly that. It's about you as the practice owner, and it's about creating the ideal practice that will support you specifically. And I always like to put in a date out here, because some of you, if you're just starting out, you may be thinking my ideal practice is actually this really big vision, and right now I'm just working out of a rented room, out of a physio or a GP practice or whatever. But you've got an ideal practice that looks like you plus 5 or 6 employed practitioners. Again, the date will be key, because that might be a 5-year vision, whereas if you're closer to retirement, you might be looking to make this sale ready and perhaps exit within 2 to 3 years. So again, put in the ideal practice date there, because it gives you something to really aim for. And if you're like me and you like to work towards something, make that date a bit of an anniversary. Maybe it's your birthday for a certain, significant birthday, or maybe it's a date for how long the practices actually exist for. So those are the first 2 steps. Look at the current reality, and then, I don't know what's happened to my slides here. It sometimes happens where it gets a little bit strange. Is that you create the ideal practice vision up here, and then we go back to, okay, well, if it's going to be the ideal practice looking like this, are there some milestones that we possibly need to hit over the next 12 months? And again, I'll refer you back to the MAT training in Optimus if you want to go much more into depth in all of this. There's a whole heap of stuff that Blake's presented about the mindset, how to create your vision, values, standards. I've done a training on defining your why and how to do quarterly planning in there. And so it's actually the part of the planning process, I think, is making sure that whatever you're deciding to do in terms of your strategy is actually in line or something that your standards, your values, your why can support. So make sure you've got those as well. And when you do these check-ins, which we did last week in our mastermind group, you can just have a quick reflection back on the big picture, standards, values, and why, and just go ask yourself that question, do these still make sense? So that's the big picture part of planning. And I think that's my biggest tip, is that you actually put it down on a spreadsheet or put it down on paper or write it up on the whiteboard, something that is the equivalent of this big picture. And then you can write down, okay, well, if that's what this is going to look like in 3-5 years time, whatever it happens to be, then if we're going to have a few key things that we need to hit over the next 12 months, it would probably be A, B, and C. If it's growing, maybe it's either, we need to move into a new premises, or maybe we need to employ another practitioner. Whatever that happens to be, a few key milestones before we actually get to the nitty-gritty planning. Because again, this big picture stuff is not detailed. When you're thinking about a big picture plan to start off with, there's no detail in it. And remember, you don't have to get it right, because it's the quarterly planning, which I'll come to in just a minute. The quarterly planning is where you need to be a little bit more accurate. So we come back to our picture here and have a quick look. The way that you get there, so we've gone from current reality down here on the bottom. We've thought about, okay, this is where we want to go. This is the now, the where. The how part of it, the strategy to get there, is the quarterly plans. And so I like to think, and this is why I was, apart from Katie's post last week, why I was motivated to actually do this little presentation. We're at the quarter end, calendar year quarter end at the end of March. And so we do a plan, and we create a couple of projects, and then we do another plan. We create a couple of projects, and then we do another plan. We create some more projects. And that is the way that we do it here at the Hive with our masterminds. We present back, and this is the process that we do when we actually present back. We have a bit of a reflection on the big picture. We look back on the last 90 days and we go, okay, look, these were the couple of projects that we did over the last 90 days. And look, this is how we went. And then next 90 days, these are the important things. These are the rocks that we're going to have. I say rocks, you might like to call them projects. But we kind of get to this quarter one, and then we reset, and then we go to quarter two plan, we reset, quarter three, et cetera, et cetera. And then at that reset agenda, this is what we do with our mastermind. We work out, okay, there's a bit of reflection, what was working, what didn't work, and then we go back and we go, do the vision, the values, the standards, the why. Do they still make sense? Yes, that's awesome. No, well, maybe we've got a bit of homework next quarter to review those. And then we review all of that, and then we present back the next quarter rocks. And again, when you're thinking about planning and quarterly planning and what actually goes into your plan, I think it's actually really key that you don't try and complicate it. One of the values here at the Hive is really just the quote by Da Vinci, which we always remind ourselves of, which is simplicity is the ultimate sophistication. And I think in any plan that you create, and again, this is the Optimus template for all of you who are in the group, you can just go and grab it from the quarterly planning section. But you basically only want, if you've got a small practice, let's imagine it's just you plus a support person, you probably only like 1 or 2 things of focus for the whole 90 days, because if you just know the whole time what is the most important project or strategically important thing for me to focus on right now, then that's the thing. Whenever you've got a bit of spare time, you can go back, okay, what have I done to forward this particular project this week? And then that just makes it simple, and then it makes it actually really satisfying at the end of the quarter to think, you know what, I've actually achieved 2 things over the last 90 days that were really strategically important for the practice. If you've got a few more people to help you implement strategic rocks so that you can actually go a bit faster, then I would say, well, yeah, maybe you might have 3, 4, maybe even 5 projects. But I from doing planning with businesses over a very long time, I noticed that the businesses who successfully execute the small things over a long period of time and don't try and bite off too much each quarter, they're the ones that are seemingly much more successful, and they are more successful at doing these plans. So make it as simple as possible, and come back to this. And I guess again, I'm just bringing up what we did last week with our mastermind, and the kinds of things that you would put in a quarterly plan are, having a bit of a theme, knowing what the context is for this particular quarter, because again, just remember, you don't have to always be growing. Sometimes you might be in a bit of a platform stage where you're just consolidating. You're getting, maybe you've brought on some new team members and you would like to just bed them down. Your focus needs to be on mentoring. Again, you've got to know what that is for the next 90 days. So maybe, this one, if you're wanting to grow, this is an example of a demo quarterly plan. But again, you'll notice that there's some key objectives here, right? So if we're doing patient care plans, it's about treatment stuff. So this is some very, very specific objectives here, and to know that, if we were successful in this project, what would that look like? And so you've got that written down very specifically. How many have I got in here? I've actually got 3. So this one was new patient acquisition. But again, remember, when you're actually making a plan, if you're looking at new patients, don't just say, oh yeah, I want new patients. Be very specific. Okay, these are the channels that we're going to engage in some more communication, and these are the results that we want by a certain date. And then this one, I guess, was another one on working with team members. So I guess if I'm going to break it down, is that the main thing with planning is that you start with what you've got, you look to what you want, and then you gradually break it down in small bits so that you've got a really good idea of what to focus on. And one of the things that I thought that I'd just mention here too is that we do, again, doesn't have to be detailed, but one of the things I think is the most valuable that we do in our mastermind group is that we ask the question every week. And I think that people who actually answer this get a lot more done, which is what's the most important thing this week? Because the reality is, strategically, I don't think we have any people within our group who have like a large business with I'd say a large business has hundreds of employees in it. Most people that and I imagine I'm talking to you, it's a small business. It's probably a turnover of less than $3 million a year. And that means that you are, as a small business owner, you're in the business. And so if you know the one most important thing that you can do each week that's strategically important at the beginning of the week, I think that would just help you really focus. And that one most important thing can be related to, one of the things that has importance strategically in your plan. And I love some of these quotes here. The most important thing is to make the most important thing the most important thing. Success is built sequentially, one thing at a time. So I think that's another thing to keep you motivated on the way. Have these check-ins. And again, one of them is the quarterly planning. And I think if you put this in your calendar, you'll notice that in our mastermind group, we have these quarterly plan present backs, and you look Wednesday the 16th of March, Wednesday the 15th of June, Wednesday the 14th of September. It's regular, it's in the diary. And so that's planned out well in advance. So we know, yes, we're working through this quarterly plan. It finishes at the specific date. And that just, the week before that particular date, I'm going to have a bit of a reflection on how we've gone. And then I'm going to present back where we're going over the next quarter. So I hope that that's actually been a fairly helpful. Sorry, I just want to get the sharing screen up. Hopefully, that's been a relatively helpful little top tips of planning. And look, actually, by the way, what I should say is that for those of you who are not in the Optimist group, or again, not in our mastermind, because it's the end of the quarter, and maybe you're watching this and you're thinking, you know what, I really need to do that. Well, there's a couple of things I would suggest. Why don't you book in a chat with me and we can talk about your plan? Come and book in. It's either hivepractice.com/chat, and there's my schedule there. You'll also find down the bottom, again, if you're not in Australia, particularly if you're in the UK, there's another thing down there that says schedule a call with Blake, and you'll probably find that his diary is much better than mine for the UK schedule. So please, we love helping people get clarity on the big picture. And again, what is the most important thing for you to be focusing on right now so you can get some easy wins? So if that's you, then book in a chat. And I hope you found this helpful. If you've got anything else you'd like to ask in the comments, this is what this Practice Owners Business Group is going to be more of, as Troy and I always have a lot of easy wins, which I would like to continue to share with you over time. See you guys.